Well, folks, I'm here at Mason County Public Health. New offices on Katy Court. Is that what it is?
Right, it's Katy
Across
Court.
from Olympic Middle School?
Yeah, on the hospital grounds.
With Dave Wyndham, Director of Mason County Public Health. You can find it online, of course, at healthymasoncounty.com. We've been talking over the years on a whole host of different things. And what's so fascinating is that when you and I first started talking about COVID information and trying to get the most information out to the public here in Mason, we were looking at different ways to do it. And we worked on radio campaigns, social media campaigns, and that was 5 years ago, almost.
Yeah.
To the day here. And you called me up and said, Jeff, I got this new thing that is really going to help Mason County and help the residents of Mason County get a better understanding, not only of kind of things that they may be struggling with on their personal lives, but then two, it will help us gather information on how we can better serve the folks of Mason County. And it adds on to what we've already been talking about. Now, this is kind of an app-based program.
Right. So we looked at a number of companies, and we went with UnitedWeCare because they have an app, and the app is different in that it's not like other apps you might have that were AI-driven.
Sure.
This uses an app that does initial screening so that the person interacts with the app around mental health issues.
Okay.
So it's around mental health issues. But the nice thing about this app is that it does connect the person with a live person. So you've got somebody who's either a counselor, a therapist, or a trained listener, because many times that's all you might need is somebody to listen. And it's free, which is really nice. We're paying for this as a pilot program.
The website, UnitedWeCare.com, I'm looking at it now, and it is a really interesting way to help deliver these resources. I can kind of see it similarly with what's happening in the North End with North Mason, as they've got their folks that kind of go out and do that initial kind of triage type of thing. Also, too, if you were to call... a lot of times you call like a phone bank now, you say press 1 or what's your problem, or you go, I need help with this, and it eventually gets you to where you need to go. So many folks, and I included, are starting to dabble in this AI space, asking questions. Mine's a lot of lawn care questions, I know, but there are people that for whatever reason, they don't have the resources to visit or have a continued conversation with a licensed therapist. And so they're using these AI programs to kind of act as their therapist, which is not 100% accurate at times. Again, it's just scanning websites. It can't give you a full-on detailed information about who you are and your background. So these types of ways that folks can, I guess, you get on the app and say, well, I'm just not feeling very well right now. And it will prompt you and get you to a space eventually where it says, well, let's connect you with somebody.
Right. Yeah. So it gets people to a place where they'll get a suggestion. So to make a connection with a provider. And the nice thing about this, how many times you have something that you're anxious at night?
Sure.
You're going to go to something, and it'd be nice to have. Your therapist isn't there all the time.
Right.
But this will give you the ability to do that, and then a therapist can follow up with that and get you some treatment that you don't have to drive to. You don't have to go somewhere else. You don't have to make that extra time.
Yeah, I see that here on the website, again, UnitedWeCare.com. It looks like there's some opportunities to connect via video chat with people. Also take these, it says real therapists, coaches. I like the listeners part of it too, because sometimes you just need a sounding board. Sometimes you just need somebody to go, like you said, I'm about to go to a party and I don't want to be a wallflower or something like that. Well, maybe it gives you a couple tips here and there, and then you're right, you check back in later. How did you do? How was that process? Okay, so let's get to the bottom line, though. This is an app. You got to download it. Where's the information? Who keeps the information? How long? Give us the privacy stuff.
Oh, okay, yeah. Let's get into the details. So this is a pilot project that we're paying for out of Mason County, and it's going to run for 90 days. We're going to enroll 2,500 people across the county, all different demographics. So this is going to be open to everybody.
Okay.
It's free. So that's kind of the big thing. What gets done with the data? So the data is all HIPAA protected.
Sure.
And on the back side, it gives us something to look at in a dashboard that's de-identified data. So there's no names associated. It's just numbers that come in. How many people interact with the app? How often do they interact with the app? How many of them went ahead and scheduled appointments with providers? And it gives us an idea of what their major area of concern was. Was it depression or anxiety? What is it that people are looking to get help with? And then down the road, that will get us the data we need to do decision making on where do we spend money in an appropriate way to help people with the most common problems.
So you say, for example, you look back at the data and you see a spike in depression, and then you check the weather forecast and you notice that it's dreary that week or something. I know one of the other campaigns you're doing is, healthy moving in Mason County. Mm-hmm. So maybe that's a way then too you can pivot and focus more on that and encouraging folks to get out, get ahead of some of these things.
Right. And that's what we're trying to do. And it also, one of the goals is to get people used to seeking help for mental health issues.
Yeah.
Get past that stigma and realize that everybody needs somebody to talk to sometime, and to not be afraid of seeking out those services, and then combine those with those things that get you moving and get you healthy and get you happy.
I think since COVID 5 years ago now, although not completely normalized, those conversations have been happening more and more. Wouldn't you say? I mean, from your perspective as director here in the county, people are either more open to ask for help, or at least look for help, or at least also maybe take the time, take those mental health days from work. It seems that we have moved into that space a little differently, a little faster maybe since the pandemic.
I think so. I think people are more comfortable with saying, I could use a little break here.
And then too,
help, yeah.
Feeling okay, taking that on themselves and go, I need this break. And people going, gee, you wuss. That doesn't happen any. People go, oh, okay, yeah, we all need this. I mean, we were so taxed over these last many years that it has become a little more acceptable, I guess.
Right. And this is something you can pull out of your pocket and interact with that I think will really assist that. So
how do you get that?
So we're going to have a campaign. We're starting with the outreach. You'll see it on our website. You'll see it, as we put out materials. There'll be a QR code. Snap the QR code, and there'll be a referral code underneath it. So you snap the QR code, you put in the referral code, and the referral code tells us where you accessed it from. So was it from the county website? Was it from Mason Health? Was it from North Mason?
Yeah.
So it gives us an idea where people are interacting from. And then you get the QR code, put the referral code in, and download and start looking at services.
So then how does that tie in with Mason Health here, or with Central Mason, for example, or North Mason Regional, or Harrison Medical? Like how will you guys all collaborate with that?
So each of those will have their own referral code. And as, say, Mason Health makes a referral through the ER or through the clinic, it will give people a chance, like I said, through the clinic. North Mason will have their own. North Mason Fire can have their own referral code. So as they're interacting with people on the ambulance, they can do referrals, say, hey, would you like to try this service?
UnitedWeCare.com is the website. If you want to start looking at this now, it's a pretty cool deal here. I'm glad you called me on this one because, more and more folks are looking to reach out and get more help with themselves. It not only helps you, but then it helps kind of all the people in your circle. Mm-hmm. If you're feeling okay, you're not bringing everybody else down. Things like that, right?
That's right.
So very cool. And we'll put the links to this website. And then when you get the QR codes out there, we'll do this too. United We Care, all part of a new program, pilot program, 90 days, you said?
Right.
here for Mason County Public Health, healthymasoncounty.com, a good way to kind of get a good sense of everything that's happening here in Mason County with all the great campaigns that you are doing in the new offices here at Katie Cordigan. You like it up here?
Oh, yeah, this is great. It's a great space.
It is nice. It is
Yeah.
nice. A little different for
Yep.
you here. Dave Wyndham, Director of Public Health here at Mason County. Thank you so much.
Hey, thanks, Jeff.